is Bree, and today we're going to start with our pediatric assessment. So before I would enter the patient's room, his vitals would have already been taken, and they are appropriate for his age. Next, I'm going to knock on the patient's door, perform hand hygiene, and we have a 9-year-old male patient with us. Well, his mother is not in the room with us, which he requested, which is absolutely fine for his age. So first, I'm just going to look at him, just look at his overall appearance. I'm going to be checking for any cleanliness issues, any obvious bruising or obvious deformities that he has. And then I'm going to start with the physical part of my assessment. So, please lean up. So first, I'm going to start with his scalp and his head. I'm going to feel around and make sure there's not any obvious protrusions, any lacerations, and there's not. While I'm doing that, I'm going to look at his hair distribution on his scalp, which is appropriate. And then I'm going to move down to his ears, and I'm going to look at his ears. And everything there seems appropriate. I'm going to go down to his neck, and I can feel his lymph nodes. His clavicles are also appropriate. There's not any, it doesn't feel like there's any breaks in those. Next, I'm going to look at his eyes. Just look at me. Okay. Follow your eyes with my pen. No, not your head, just your eyes. Okay, the patient is Perla. So after we do that, I'm just going to look at his mucous membranes. Please open. I'm going to look around in his mouth, stick your tongue out and say ah. The uvula movement is appropriate. The teeth overall look good and clean. I'm going to look in the nares. You can shut your mouth. I'm going to look in his nares, and there's no signs of a deviated septum. Blow. Blow. Okay, and what I just did there, I was testing the patency of his nares, and they are patent. So next, what I'm going to do is I'm going to start looking at his arms. I'm just going to move down. So I'm going to sit. I'm just going to move down and look at his arms. What I'm looking at is hair distribution. I'm looking for any obvious bruises, any contusions that are on his arm that could indicate something else. So what I need you to do for me is get your arms up and push against my hands. Okay? Now pull my hands towards you. Okay. What I was measuring there is I was making sure that his muscles are the same on both sides, and they are. Next, I'm going to go ahead and assess the, I'm going to go ahead and assess his lung sounds. Lean up for me, please. Take a deep breath. Okay. You can let it out. Next. Deep breath. Okay. I'm going to check the front. Just breathe normal. Okay, so the lungs sounded good to me. There was no obvious crackles. There was no obvious lung sounds that are not normal. So while I'm doing the lungs, I'm also going to check his heart rate. I'm going to go ahead and listen to that. Okay. I'm going to check the apex of the heart, the mitral, tricuspid, so all of his landmarks of his heart sound good, and there was no obvious sounds of like a murmur or anything like that, so that's good. After that, I'm going to ask the patient to lay down flat on your back. Just put your legs out straight. Okay, so what I'm going to do is I'm just going to listen to his bowel sounds and make sure that they are normoactive. So we would check all 4 quadrants for 5 minutes. And if there was anywhere between 15 or 5 to 30 bowel sounds, then that would mean that it was normoactive. In his chart, I would have information about his last bowel movement and the color and consistency of the bowel movement to make sure that he is having appropriate emptying. So while he is laying down, I would just feel around on his stomach. I would make sure that there's no obvious hernias or any masses coming from the stomach. Also, while I'm doing this physical assessment, I would make sure that there's no obvious bruising throughout the body. Okay, so next I'm going to look at his lower extremities. I'm going to look at them bilaterally, and I'm just going to make sure that the hair distribution is appropriate and that the strength is appropriate. So go ahead and push against my hands. Okay. So bilaterally he does have appropriate strength in both legs. Okay, next, stand up for me. Okay, next we're going to look at his spine. So what we're going to do is, please bend over and touch your toes. Okay, so what I would do is I would feel up and down his back to make sure that his spine is straight. There was no signs of lordosis, kyphosis, or scoliosis, and there's not. Okay, so I'm going to check his balance now. Okay, so what I need you to do is walk like me. Okay, that's appropriate. Now can you squat and walk like a duck? Okay, stand up please. And those are both appropriate. Overall, throughout this assessment, his attitude has been good. So that's good. He's acting appropriate for his age, 9-year-old boy, which is shy. So that's not anything unusual. I'm sure if we were not videoing this for nursing school, he would be answering questions appropriately for his age group. So next, please sit down. Next, what I'm going to have him do is just part of the physical assessment. If there was anything unusual that I would see, like obvious bruising, I would ask him more about that. But because everything looks okay, I'm good for this part of the physical assessment. Okay, you can go. Also, another part of the physical assessment would be the genitalia. So what we would do for a 9-year-old boy is we would have him lay down and do a sit-up position. And basically, we would just be examining the testicles to make sure that he has no undescended testes or any pain or anything like that, and that everything's developing properly. Thank you.